Welcome back, friends. Surgery is often considered the last resort when all other treatments fail. However, there are many alternative approaches that can help manage or even reverse certain medical conditions without the need for surgical intervention. Understanding these options requires us to look deeply into the causes of illness, how the human body works, and how it can heal itself with the right support. In modern times, medical science has progressed greatly, yet chronic diseases and lifestyle-related conditions have become more common. Many of these issues are not the result of an immediate need for surgery, but rather the gradual damage done by poor lifestyle, lack of exercise, bad nutrition, and mental stress. The body has an incredible capacity to heal itself, given the right environment. When we feed the body well, allow it to rest, manage stress, and use natural or supportive therapies, we often see improvement without needing to go under the knife. For example, joint pain that is commonly treated with knee replacement can often be managed with physiotherapy, weight loss, and anti-inflammatory nutrition. Similarly, gallbladder stones, which are frequently operated on, can sometimes be managed through specific diets, herbs, and lifestyle adjustments. The key is to act early and to be consistent, but this path demands patience, education, and often a mindset shift that sees health as a long-term investment rather than a quick fix. When we look at alternatives to surgery, the first and most powerful method is lifestyle management. This includes improving our food choices, sleep habits, physical activity, and emotional well-being. What we eat has a direct impact on how our body functions. A diet high in processed foods, sugars, and unhealthy fats contributes to inflammation, which is the root of many chronic diseases. Replacing these with whole foods, leafy greens, fruits, healthy fats like olive oil, and anti-inflammatory herbs such as turmeric and ginger can reduce the burden on our organs and reduce the progression of diseases that often lead to surgery. Sleep is another powerful healer. Lack of sleep disrupts hormones, increases stress, reduces immunity, and accelerates disease. Getting 7 to 8 hours of quality sleep every night is essential for the body to repair and detoxify. Weight management also plays a critical role. Excess weight puts pressure on joints, increases the risk of heart disease, diabetes, and even certain cancers. Many surgeries are avoided when individuals lose just 10 to 15% of their body weight through sustainable lifestyle changes. And then comes stress. Emotional stress creates physical damage. It increases cortisol levels, which promotes inflammation, disrupts sleep, and weakens the immune system. Simple techniques like deep breathing, meditation, spending time in nature, and spiritual practices can reduce stress dramatically. The most important element is consistency. Healing is not a one-day event. It takes weeks, months, and sometimes years of steady effort. When individuals take responsibility for their health through causative habits, the need for surgery often disappears. For example, a patient diagnosed with multiple blocked arteries was scheduled for bypass surgery but chose to follow a strict lifestyle regime, including plant-based nutrition, daily walking, yoga, and meditation. Within 6 months, their symptoms reduced drastically, and surgery was no longer required. Another woman with a fibroid in her uterus avoided surgery by following a natural regimen involving hormonal balancing foods, stress relief, and herbal therapies. This shows that the body, when supported, can recover naturally. Beyond lifestyle, there are ancient systems of medicine that focus on the root cause rather than just symptoms. These include Unani medicine, Ayurveda, homeopathy, and traditional Chinese medicine. Unani medicine, based on the concept of body temperaments, believes every person has a natural balance: hot, cold, dry, or moist. Disease occurs when this balance is disturbed. The treatment aims to restore this natural balance using herbs, dietary guidance, detox techniques, and sometimes gentle therapies. It focuses on prevention and natural restoration of health. Ayurveda, which originated in India thousands of years ago, is a complete system of healing that focuses on three doshas, Vata, Pitta, and Kapha. When these energies are out of balance, disease occurs. Ayurvedic treatment involves herbal remedies, special diets, lifestyle routines, yoga, and detox therapies. Many people have reversed chronic diseases such as arthritis, digestive issues, and hormonal disorders using Ayurveda. Homeopathy works on the principle of like cures like. It means a substance that causes symptoms in a healthy person can, in very small doses, treat similar symptoms in a sick person. Homeopathic remedies stimulate the body's own healing mechanisms. Conditions like gallstones, skin problems, migraines, and even benign tumors have been treated without surgery using homeopathy under the care of experienced practitioners. Traditional Chinese medicine emphasizes the flow of life energy, or qi, through meridians in the body. When this flow is blocked or imbalanced, disease results. Treatments like acupuncture, herbal medicine, massage, and qigong aim to restore balance. It's effective for pain, digestive issues, women's health, and emotional well-being. All of these systems prioritize balance, prevention, and healing from the inside out. They don't see surgery as the first option, but rather as a last resort. However, it's essential to approach these treatments with guidance from qualified professionals, not blindly or without understanding. They require time, commitment, and personalized plans. When used responsibly, these systems offer a rich and time-tested path to healing. A man suffering from gallstones avoided surgery by using Unani cleansing herbs and a gallbladder-friendly diet. A senior patient treated for arthritis using homeopathy avoided knee replacement. These are real stories of real healing. Modern science has begun to validate many of these approaches, showing that they are not mere tradition, but grounded in powerful biological principles. By integrating lifestyle changes and traditional systems of healing, we open up a new path to health, one that is gentle, sustainable, and often free from the risks of surgery.